Welcome to the AgeTech Collaborative Forum from AARP. If you are an innovator who wants to work on problems that matter with the upside potential to change the world, this is it. We're here at CES with AARP and many partners to talk about how we can apply emerging tech to make aging easier for billions of people worldwide. So today we've already covered many aspects of AgeTech, from customer demographics, to policies, to investing, to some innovators who actually have some point solutions out in the market. And we're going to end by talking about the infrastructure, right? How do we create the infrastructure so all these innovations can take flight, right? Because we want to make sure that all the great ideas that you're working on, there's a way to deploy them. So we're so excited to have this conversation with the great folks from MITRE. So welcome, Brendan McEntee and Catherine Kim. Welcome.
Thank you. And we're very excited to be here at AARP's booth and really appreciate the opportunity to come and support the mission of AARP, which is very aligned with ours. We are investing in the space because we know that the demographic trends AARP is highlighting about the change in population, where there's going to be much more older folks than younger folks, are going to need a lot of innovation. And that innovation can come through 5G. I'm going to give just a little bit of background about MITRE and MITRE Ingenuity. My favorite tagline about MITRE is from the Forbes article that calls us the most important company that you've never heard of. And if you've come to CES via airplane or you've used GPS, GPS is one of the technologies MITRE pioneered, as well as the air traffic control system. We operate what are called federally funded research and development centers, FFRDCs. There's about 40 of these in the US, and MITRE operates 6 of them with a staff of about 9,000, doing research and development for the government where they need extra assistance. MITRE Ingenuity was formed about 2 years ago because we recognized that in order to achieve the mission of our federal government sponsors, we needed to engage with the private sector. So that's why we're here. I'm not going to go into too much more details because tomorrow at 3 p.m. we'll be here doing a reverse pitch where we can talk a little bit more. One of the areas I wanted to highlight is MITRE Ingenuity's Open Generation Consortium. We created this recognizing that in order to innovate in 5G, no one entity can do it alone. As an example, we pioneered an aviation test bed. If you think about uncrewed aircrafts, the ability for those to be able to operate in 5G is very complex. One, they're going to be in restricted airspace, so we needed to bring in the FAA and sort of coordinate with them. 2, if they're traveling a distance, they're going to encounter many different telecom providers. There's going to be networks that are public and private, all with different bandwidths. So how do you experiment in those environments? And 3, there's many privacy concerns from all of the different sensors and visual videos that are on these things. So there's a lot to sort through, which is why we created the Open Generation Consortium. This slide talks a little bit more about some of those benefits that I just highlighted. But what I want to talk about here is 5G and sort of why we're here. We think about the innovations that have come in the past, connecting the digital world to our phones. Those are things that we're pretty aware of. But what we're talking about is sort of the next generation of innovation that's going to be around all the Internet of Things connected devices. So our phone will be able to access thousands of devices within a short range that can really merge the physical and digital worlds with the human world in a much different way in the past. We're sort of starting out thinking about those things right now with connected light bulbs. You may have an Alexa or something in your home. That's really sort of the start of where we can go with all these connected devices. And what we're doing at Ingenuity through the Open Generation Consortium is thinking about envisioning a world where all those devices with real-time data and information and computing power can be optimized to support healthy aging in the future. We're really looking at the health span, all the connected data devices, and optimizing the connections between those. I'm going to turn it over to Kathy because while we've launched our 5G test bed for aircrafts and those uncrewed tests, where we're going next is in the smart home. We're also going to smart communities and healthcare. So Kathy's going to talk a little bit about where we're going.
Great, thank you, Brendan. So I want to talk about the smart health ecosystem. So a lot of the technologies that we think about in digital health are about one individual, one home, one disease at a time. But the smart health ecosystem is really connected. So this includes applications, it includes monitoring devices like remote patient monitoring, it includes sensors in the home and in the environment, but it also includes that infrastructure, right? This data has to go somewhere. There has to be a network, there has to be security and privacy. There has to be a way for that data to be exchanged and analyzed in a way that actually makes sense. So we have big data, but we also have clinical data standards that all the medical devices are generating, that the electronic health record systems are generating. So we need mechanisms to bring all that together so we can actually make sense of it. Right, so the digital health ecosystem is not just about one-by-one technologies, but it's the ways that we share information, that we share the data, we share the networks in ways that make sense for individuals, for communities, and for healthcare organizations. So this is the digital health ecosystem that we're talking about. If we'll go to the next slide, and this is a concept that we've been talking about. You think a lot of people talk about high tech versus high touch, right? High tech is if you don't have any relationship with the people, but you use the technology to do something. High touch is usually talked about where you're one-on-one with individuals, right? You're really working together in a very deep personal relationship. And sometimes people think of it as if they're two completely different approaches. We like to talk about right tech and right touch, because in healthcare, it takes both. You can use lots of technologies that are high tech. Those are the kinds of things like remote patient monitoring devices, sensors, computation and analytical frameworks, which might be machine learning and AI, although a lot of times people say lots of things that are AI that are not really AI. But those are sort of high-tech approaches. But you have to have the human element, right? You have to have providers that lay hands on patients. You have to have people who are assisting those individuals to understand what this all means in their daily life. There are a lot of people who can't use the technology or don't have the skills to understand all the complex data and information that's coming from healthcare. So you need someone who has that personal, trusted relationship with them that can be their navigator through that healthcare system. So we think there's a place for the high tech and the high touch to come together in ways that you have solutions that are both the right tech and the right touch. So we really like to think about that as a way you bring technology, the human element, and the connectivity between all the organizations together.
Well, thank you for that setup. And first of all, thank you for GPS. so okay, let's just start there, because I get lost leaving my driveway. And I remember the Christmas that I opened up my gift from the family, and it used to be like maybe some lovely whatever loungewear, but that was the year I got the Garmin, and I think my family gave a standing ovation. My kids were like, "We're not going to get lost with mommy anymore." So thank you. But really, what I love about that story is it was designed for one use case, and it was commercialized, and then it became something that we all can, it's just like an actual part of breathing. Like, we cannot live without GPS. And it became ubiquitous, right? And so your analogy of, flights having to go through so many different, ecosystems to land the plane, when we think about the smart home and all of the healthcare tech that we've been talking about all day today, like, who is the integrator? Who is like who's sitting in the control tower, like absorbing all of this data that's showing up? I mean, providers were trained to do the high touch, delivering medical care, and now we're asking them to be IT specialists. So help us understand, what are the use cases for 5G in the context of smart home and smart city for healthy aging?
Yeah, well, there's a whole, obviously there are lots of use cases. We'll just highlight a couple of them. So you might have heard about the hospital at home movement, right? As the cost of care in hospitals becomes very expensive, we have staff shortages, provider, physician, nursing specialist, all kinds of therapeutic disciplines. There are staff shortages, right? And so the cost of keeping people in a hospital in intensive care or in med-surg units is very high, and we don't really have the workforce to take care of them. So you can rely on technologies to do hospital at home. So for those patients that need monitoring but not necessarily lots of intense procedures, you can send them home. But you have to have the devices. You have to have medical grade monitoring devices. You have to have the home set up with the right furniture. You've got to have the not just the equipment, but the connectivity in the home that is flawless, right? You cannot afford to have lapses in connectivity. You also need it to be high enough bandwidth so that the medical data from these devices can flow through. So that may not be the kind of bandwidth that many people have in their homes. This is where 5G is important. These are Internet of Things devices that you cannot have latency and you cannot have low bandwidth. So that's really important. So one of the use cases is hospital at home. Another is now they may be at home, but they need to get to a hospital. So you need connected ambulances, right? And again, these are critical devices. They're vans, right? They have to be outfitted with all the equipment, which they often are, but that doesn't mean that they're connected with the hospital, right? So they may have the monitoring equipment in the ambulance, but that data doesn't get to the hospital before the patient does. And so they can't prepare appropriately. So another use case is actually as the ambulance is moving to have adequate network so that they can get the data to the hospital so the hospital is prepared when they show up in the ED. A third example would be remote patient monitoring for something like chronic illness. We have obviously many aging people who have chronic illnesses. This is really starting sort of in middle ages and then getting much higher rates of chronic illness as people get older. Well, now we've got lots of monitoring devices for things like diabetes and high blood pressure and other, cardiac diseases. But a lot of people don't have access to those, right? Either because it's not covered by insurance, or they don't know how to, they don't have the means to actually buy these devices, and they don't have the knowledge about how to use them or get that data to providers where it's actually going to be used for treatment plans, for care plans. And so this is another use case for technology with devices that we already have. If we just had a business model around it, if we just had the appropriate connectivity and network around it to get the data to the providers and information back to the patients, we could actually make it much more effective for managing chronic illness. So those are some of the use cases that we think about.
I want to add one or two things. And Danielle, I'll say, first of all, you're completely right that there is not one entity alone that can solve this. And you need somebody who has a lot of cross-expertise in these different domains. I'll say that walking around the AARP booth here, it's been very exciting to see some of the technologies that are already being pioneered. I've looked at Raz Mobility, which has this wonderful wheelchair that's been set up and is a smart wheelchair. That's one that really stood out to me. Also the Kasana with its heart seat. Imagine those type of devices and how they interact with each other. And that's sort of what we're envisioning in a world at MITRE, where we have a systems of systems integration. So something that comes to mind in the smart city, in the smart home, is thinking about your smart scale, that being able to connect with your smart fridge, that being able to connect with your smart thermostat, and all that data integrating and going back to your healthcare team. So you can get insights about what food to purchase, how to use that, and even get nudges as you're sort of moving through your neighborhood. You go into the supermarket and you get a little nudge that this is the item you need to pick up that's healthy for you based on sort of what's in your fridge and what your care team has suggested has the best items for you. So those are some of the ideas we're envisioning once you get all these systems of systems between the infrastructure that's going to be all connected, all the new devices that are existing in our home, the thousands of devices that will be within our reach to optimize sort of our health span and the way that we live.
And I'm now imagining, so you've got the connected toilet seat, as we just learned about. You've got the weight scale that's telling you about your balance. You've got all of this home, hospital, medical grade that's keeping all your biometrics and so forth. And then what if, it then triggers the call to the connected ambulance before any doctor or any alert happens? The devices somehow know you're heading towards an event. Let's dispatch the ambulance before you even have to call 911. And then what if it was an autonomous vehicle that then got you there? And I love your thought around the data needs to get to the hospital before the ambulance so that the team can prepare, right? So this notion of yes, design a point solution, but be very clear about how that point solution fits into a series of connected events, right? To have this seamless experience.
I think that's a really good point. That seamless solution has to go from smart home to smart neighborhood and smart city, right? We cannot just think about how do we enable smart home technologies and then stop at the front door. Because people go out in the world, whether it's to get healthcare or whether it's to just live your life, right? They go out in that world. So how do you extend that smart home, everything we know about the individual, to follow them as they walk out the door and interact in the neighborhood and in the rest of the city? That's really the vision, right? What you know about people, in every case, use it to make their lives better.
And I'll add in the data streams. They're all separate right now. So how do you make sure you can connect the data streams across these different devices, these different companies? You can comply with all the privacy rules that exist, comply with healthcare privacy rules. Those are really big challenges that we need to unpack.
So these are the opportunities. Help us understand MITRE, 5G, OpenGen. What are some of the projects or pilots, or how are you okay, let's get into it? How going after it.
So at MITRE, we have 100 different labs that are all set up for different purposes. And it really is about bringing in all of those different stakeholders so that a company that wants to create the next big tech doesn't have to worry about aligning all those parties together. So that's one thing we're really interested in partnering with CES companies here, is to bring you all and your ideas into our test beds that are already established.
And the other is not just in our labs, but we have real test beds, real in the real world, right? So we're working with healthcare organizations, with health centers and hospitals, with cities, with community organizations, so we can test these solutions out in the real community. So one of the projects that we have is called Activate. And this is a remote patient monitoring project for people with diabetes and hypertension. We've actually implemented it in rural communities through community health centers with hundreds of patients who are being monitored at home, who are being taught what to do with that information through health coaches at the health center. And that data is coming back to the providers at the health center so they can make real-time decisions to change medication, to reach out and educate them on something that they need to do, or to bring them in, to have additional lab tests or procedures. So in the real world, we're trying to construct these solutions that can actually be feasible and sustainable, right? Because that's what we want, is not to just have the innovations in the lab, but actually get them out to the community and say they really work.
One of the thorny problems with thinking about all these connected devices is designing solutions that are able to operate at different bandwidths as they move from a network that has a lot of bandwidth to one that has a low bandwidth. And if you're collecting a lot of data and using that data for real-time decisions with computing power, you need to be able to understand where that computing power lives. Will it live in the cloud? Does it need to live on the device? And you need to be flexible based on sort of what the community setup is. So a lot of ways we're trying to help is by creating those real test beds, as Kathy said, where you can produce data that will allow your product to function regardless of the environment. And a lot of this data cannot exist right now because there isn't actually a test bed for it. I think the uncrewed aircrafts is a good example where policymakers need that data in order for the innovation to be able to live. So we want these groundbreaking innovations to come alive by creating the data that shows they're okay to exist.
So, it's innovators, it's kind of hard enough to find like who your channel partner is and your customer. Like you might find the right ideal customer, but now we're learning if they're not in a smart city enabled community, right, that could not only in their home, but all of the bandwidth to their home and to their place of care. So help us understand sort of like that digital divide. I'm glad you mentioned the rural communities, right? Because we want to make sure that we can get and connect the best care to people wherever they are. So how does 5G and all of this help with that?
Yeah, so obviously many people know there is a digital divide, and it's digital divide in terms of people's socioeconomic status. So people who are lower income do not have access to broadband connectivity, but they also don't have access to medical devices or tablets and smartphones, and they can't pay for, even if they have a smartphone, they often have a metered plan, so there's limited bandwidth or limited amount of data they get on a monthly basis. So there's that kind of digital divide. But there's also a digital divide in terms of people's acceptance of technology for different purposes. So for older people, there's a lot of skepticism about this connected device and how's it going to help me versus allow someone else to monitor me that I don't want monitoring me, right? How is this actually going to improve my health, and how do I trust it? So that digital divide is about people's acceptance of the technology and their trust of the organization that's bringing it to them. So there's lots of investment going on in this area. There's federal programs. Right, this year there was announced from the NTIA and FCC, $68 billion for addressing the middle mile infrastructure for broadband and getting that into communities that have the burden of lack of access. But what hasn't happened is that hasn't been connected to the health system or the social services systems. So that's one way we can actually support that. Bring the healthcare community, bring the technology, digital health community to those state organizations and those state programs that are bringing the connectivity to those residents. Get digital health involved in that, right? Because we can then address both the digital equity in terms of broadband access, as well as digital equity in terms of using it for healthcare.
And it sounds like a little bit of a bootstrap problem too. Like for the cities to make those investments, they need to know that the solutions actually work and that there's better measurable outcomes. So having your test beds, to give those proof points, and then the sort of advocacy, but also it seems like even like the playbook, to then do that investment and install it, or actualize it. Yeah.
And I think this is where MITRE and MITRE Ingenuity are important, because we can be that neutral party that brings all this together. We're not going to take the technology and commercialize it, right? We're not going to try and get profit margin from putting these solutions together, right? We are organized for the public good. So we can be a neutral party that can inform the industry, bring them together with the federal sponsors and say, how does this all work for everybody?
I think there's a really important role for consumer electronic companies here too. The consumer electronic companies that are really working to attach to these funding streams, if it's the infrastructure bill that's come out, helping communities be able to implement the funding from that so they can establish these. If you think about Medicare and Medicaid, what are the devices that are approved and funded through those vehicles? A lot of companies that are being very innovative here are designing their products with that in mind from the beginning so they can get to the consumers, which helps break down that divide.
Right, and so that's what I was going to ask you next. So your advice to innovators, right? Like, what are the non-starters? If they built a solution that has XYZ about it, like it's just a non-starter because it won't integrate into anything. Or what are the things that they should bake in?
I'm going to steal some of Kathy's thunder, and I will pitch her the end user, making sure that the person who's at the end of the system is in mind right from the beginning. That's sort of one of the biggest pitfalls.
And I would extend that to say it's not just user-centered design, but it's co-design. And co-design is a process where you're engaging with all the stakeholders in your ecosystem to understand how the solution, that not just the device itself or the technology itself, but the environment in which it needs to work. So that means the payers, right? It means regulatory areas, it means policy, it means the funders, it means people themselves that are going to use it, their family members. It means engaging with the whole ecosystem as you co-design the product from the very beginning, so that you don't get blindsided later on by, oh, I didn't know somebody wasn't going to pay for this, or I didn't know can't work in a hospital because of certain, privacy and security firewalls, right? You need to know all that as you're designing your product.
And so does MITRE and the Ingenuity Group publish, these best practices, or how does somebody kind of get themselves educated about all of this before they approach you?
We publish, we open source software, we do lots of talks and webinars and things to bring that out. If you come to our booth, in fact, one of our cybersecurity experts is showing how to hack medical devices. Something that you need to know about so that you can make sure that your device is not hackable, right? So we do try and disseminate these things as much as possible.
Kathy is good. I would agree with her 100%.
Yeah, well, and I think to put your innovation, you're through these paces, and from different perspectives. So does it work for the primary user? How easy is it to get to yes for the channel partner? How easy is it to integrate into a community? What communities are doing this really well? If you look at, smart cities, what communities out there are leading the way?
We're in trouble because we're missing our smart cities expert, Meredith Benedict.
That's true. She's got COVID, so right. So mask up. Okay. Okay. Good. Yeah.
But one comment, I think it's so true about the expertise that you need to be able to access to implement these different solutions. So across MITRE, because we operate these different federally funded research and development centers, one thing we can really help with is being able to pull in that different expertise that you might need somebody who understands the economics of how healthcare works. You might need somebody who can do deep machine learning. You might need somebody who's an expert in co-design. We have a broad staff of 9,000 who all have different domain expertise that can pull from.
So does it cost anything to do? How does one apply? How does one get to hang out with you?
There's lots of different funding streams. A lot of it comes from the federal government through the federally funded research and development centers. But through MITRE Labs, which is actually the part of MITRE that I sit in, we also work with private industry and with foundations and other funders to do these kinds of research projects or to disseminate the knowledge that we have learned. And in Ingenuity,
we have many different vehicles to engage as well. I think the key thing that drives us is where we can have impact that aligns with sort of our mission. So oftentimes we will fund sort of our own innovation and work with partners because we want to be able to be in the hospitals, so we'll establish those. We also identify grants that we can work on together, and then we also work with industry directly, has that neutral party who's trusted to work across competitors to be able to help them be able to advance their technologies in ways they couldn't do on their own.
Wow. So this is, I like, for innovators who are out there struggling on their own, this sounds like such a beautiful and high impact partnership that really can accelerate their impact. So thank you so much for the work that you're doing. Really appreciate it. Final words, super quick. What are you excited to see here at CES? What is totally jazzing you right now?
Well, I have to say I came from another panel where we talked about caregiving and technology. And one of the really exciting things was to exhort all the consumer electronics companies that are here, if you've got a product that is for an individual, to think about their caregivers and what the caregiver needs, and add a feature for the family member into that product. And that's something I would really be excited to see at next year's CES.
Oh, okay, a whole care track. Thank you for that.
And I'll say I'm really excited to hear what people want to see as advancements for healthy aging. That's what I'm here to get input. One of the things we want to create are these grand challenges where we bring together a bunch of different funders to make those ideas come to life. So I want to hear from everyone sort of what your ideas are and how we can work with you to make them come alive, because we're going to need it from the caregiver perspective and all the changes that we're going to face in the next couple of years.
Well, and we'll end on that note that we like to say here at AARP and the AgeTech Collaborative that we are they. Like, we're actually designing for our own future selves. So again, thank you for the work that you're doing. We're so excited to continue this wonderful collaboration. And
Thank you, and thank you to AARP for having us here.
beautiful. Thank you.